We're the only state in the nation that requires every city or town to have a veteran service officer. Most other states, that is a county-based position. And for most of those folks in the other states, they handle primarily VA claims, disability claims or VA pension claims. Our folks actually are statutorily enabled to give out assistance dollars, state taxpayer dollars, for income and medical and heating and other types of living expenses right there at the community level. We reimburse those communities 75% in most cases, 100% in certain cases involving homeless individuals. And that's really the relationship that exists between our office here at the state as well as with the local vet service officers. The local vet service officers are on the front lines. They're meeting with the veterans from their communities, and they're expending the benefits. They're helping them. Then they come to us. We authorize their expenses, and we reimburse them the monies. That's pretty much our most intense relationship with the vet service officers. On the backlog issue, where a lot of these folks are turning to their local vet service offices for help, there's a few reasons for the backlog. Number one, certainly it was a technology issue at VA. Up until recently, VA was really operating on a system that was heavy on paper. Number two, probably didn't anticipate the number of vets they were going to see from post 9/11 wars. Certainly hadn't ramped up for the amount of people who are going to be deployed. And number three, and this is something that they did, I think, which is a good thing, but it contributed to the cause, is they looked at Agent Orange exposure to our Vietnam veterans, and they determined that there were about 8 to 10 different ailments that people were coming down with that you could pretty much directly connect to exposure to Agent Orange. So what they said to these vets is, if you have any of these ailments out of this particular list, and you were in Vietnam, we're going to automatically assume it's a presumptive condition and you're connected for your exposure. And so that resulted in a lot of Vietnam vets, which are the biggest group of veterans that we have both here in the Commonwealth and nationwide, filing even like more claims than they ordinarily would have. So kind of a perfect storm of a bunch of paperwork coming in to a system that really wasn't ready for it and hadn't modernized itself in quite a long time. Massachusetts is probably a lot better than most of these other states. We've worked with the local VA and have taken some steps that are helping to reduce the backlog. Right now, I think there's all of the claims that were 2 years in waiting have been cleaned up. And according to my folks that work at the VA, we're down to the claims now that pretty much just over a year old. In terms of their disability rating, and trying to get that back down even further. I don't think there's too many in the way of actual numbers that are out there that aren't being looked at right now. I think, in fact, for the most part, all of them are being rated and rechecked, or at least contacts going back to the veteran themselves to determine, whether or not there's more information or anything else that we can, that you can provide that can help hurry this up. But what we've done specifically to try to help that, situation and unclog that backlog is really work closely with the VA to encourage veterans to file fully developed claims. And I'll tell you the reason behind that. The VA has what they call a statutory obligation to assist veterans, meaning, if you or I file a personal disability claim with a commercial insurer, the commercial insurer is almost sort of playing a little bit of goalkeeper, like you're filing the claim and, we make money based on keeping our rates low. So, we're not going to give you any additional help to help you get this claim. VA actually has to give you additional help to help you get the claim. By statute. And so what that did was have the unintended consequence of if a veteran would file paperwork, VA would then, over the course of time write them back and say, are you sure this is all the paperwork you have? Do you have this? Do you have that? They would give them recommendations. And then while that veteran was gathering that claim still sat dormant. So by the time the veteran finally got all the paperwork in and the correspondence had gone back and forth between VA and the veteran was finally like, yes, this is my final claim, VA would then say, okay, great, then it goes into the queue to be rated. Now it's almost like, so it's a long time to collect documents, and then you get put at the back of the line in order to get rated. What we discovered is that if we work with VA to really implement in a much more aggressive way what they call a fully developed claim process. And essentially what that is our vet service officers and our VA office here that we operate and employ have told veterans, look, we're only going to file what they call a fully developed claim, meaning we're going to help you gather the information, we're going to give it to VA, and we're going to say, that's it, that's all we have, make your determination based on this information. That takes out that waiting period of the collection process and puts you right into the queue. As a result of that, we've seen veterans get claims now in 90 days, 60 days. I mean, some of the stuff has been really like boom, it gets rated, it's pretty well documented, and we're able to move it forward. And I would encourage any veteran looking to file a claim to go that route, the fully developed claim route. It's going to get you seen faster. Our vet service offices can help you gather the information. Our office in Boston can help you gather the information, and it'll provide a lot more satisfaction and a lot more of a timely response for you than the ordinary process. I've asked Boston Medical Center here, the Boston Medical Center VA, if this is a problem for them. They've assured me it's not. I know the situation, and I know the VA's Inspector General is looking into it. But if even any of it is even close to being true, it's disgusting. I mean, that should not happen. We really encourage people here to understand in Massachusetts that not only can you use VA, but there are also a lot of community-based services as well as our vet service officers. If you go in to apply for benefits at a local vet service office, we will try to sign you up for VA, but at the same time, we also might sign you up for Medicare if you're eligible. We'll cover, if you're in the income eligibility, we'll cover your prescription drug costs, we'll cover your co-payments. I mean, these are all benefits that you've earned, and they're unique to Massachusetts veterans because we do that through our own budget. And I would encourage people to do that. If you need medical care, do not wait for, and you feel like you're on a VA waiting list or you're not being seen as quickly enough. Go talk to your vet service officer, let them know. If we can sign you up for alternative coverage or try to get you some alternative sources, we will. I mean, that's primary. And then we'll figure out, why is this taking so long with the VA. But we haven't seen the allegations around that type of stuff here in any of the medical centers we work with in Massachusetts, and I hope that's the case, and and it remains the case, because if what in fact did happen in Phoenix did happen, then they really ought to hold some people accountable. That was disgusting. SAVE was in fact established as a suicide prevention program, and which is needed, even 5 years ago. But even today, the stats are unbelievable. 22 veterans a day on average commit suicide, and that is unacceptable. We've lost more veterans to suicide than we have in actual combat since post 9/11. And we view that as just being one, unacceptable, but also two, what are the root causes of that? And when we dig into it, we find that it's a lot of times people had services or benefits available to them that they didn't know about or couldn't access readily or couldn't navigate the system because it was so complex, and so they gave up trying. And we essentially didn't want that to be the case. We wanted to provide these people help. And we found that the best way to provide a veteran help, especially someone who's been in combat, is you have to validate the services and the resources and the benefits with other vets, particularly other combat vets. So we took a team of mostly younger vets from Iraq and Afghanistan, and or had served, we tried to diversify different branches of the service, different genders. Women are the fastest growing segment of our vets population, so we wanted to make sure we had some women vets on there. And really take those folks, train them on how to navigate the system. VA is one leg of a three-legged stool. VA has programs and services, the state has programs and services, and more importantly, where veterans live and work are in our community, and there's a lot of community-based services that can help veterans. Problem is, because you have so many resources and it's layered over so many different bureaucracies and different levels, that's where it gets hard to navigate. So we train these vets, these peers, in how to navigate that system, how to figure out what's the best benefit for someone regarding if they have a particular ailment or a particular situation that they need to that they need addressed, and what's the closest to that veteran's community and where they live and work. And then we gave them geographical regions to operate within, and we sent them out and said, look, operate within these regions. Find the vets in your community, find the family members of the veterans in your community, identify all the resources within that community, not only VA, not only us, but other resources, things that can help people. And then when you meet those veterans, walk them through that system. Teach them how to navigate that system a bit and stay with them to make sure that they make those connections. And using fellow vets who, you know, some of these veterans would come back and they wouldn't necessarily tell their mom what they've been through. They wouldn't tell their wife or their husband or their parents or their friends because they would feel there's no common understanding. You know, it's, you know, if I told you about my combat experiences, you wouldn't necessarily understand. And in fact, I'm afraid you might even look at me a little different based on some of the stuff that I've had to do. These fellow combat vets, they're able to make that connection right away. You know, the issue of you don't know what it's like is way off the table. They're able to make a connection and say, okay, you understand what I'm going through. Now, what are my resources? How can I get some help? And that's what SAVE really does. SAVE is out there in the community working with our vet service officers, working with community-based providers to make those connections with veterans and family members and get them the help and resources they need in a very big and complex network of systems and various providers. And you know, try to teach them how to navigate that system and eventually you know, understand that these are benefits and services that they've earned and we want them to take advantage of them. It's never been about a resource issue. There are resources available for veterans and family members more than for that population than there are for just about any other population in this country, and especially in the Commonwealth of Massachusetts. The problem is navigation and coordination between those systems. You know, one of the things we've really tried hard to do is, you know, when you know the Patrick administration first came in and I came down here, we looked at, you know, what are the federal resources? And looking at the federal resources, we discovered that the feds speak a certain language that necessarily the state didn't speak, and there wasn't the communications between the federal and the state agencies that needed to take place. Then we also looked internally, and we discovered there wasn't the communication between sister agencies within the state. So I was running I'm running vets programs. The Department of Public Health has services for vets. The Department of Mental Health has services for vets. Our Department of Labor has workforce program for vets. The Department of Education has all these veterans programs on campuses, which are then, you know, layered down to the individual campus level. No one's talking to no one was talking to each other. And that really was the challenge, you know, because veterans were finding it very frustrating, and they'd go into one door and they wouldn't find out about all these other services or benefits. Bringing those people together and trying to coordinate those services and working through the leadership. So not just myself, but the Secretary of Health and Human Services, John Polanowitz, who's an Army veteran, he's a West Point grad. Our Secretary of Education, Matt Malone, is a fellow Marine and a Desert Storm veteran. You know, we all wanted to work together with the other secretariats and really coordinate and make sure that we're all talking to each other in a way that, you know, our benefits and our structures and our service delivery systems are really lining up. And we've made a lot of strides in that. There's a way to go. I'm not saying there isn't, but we've made a lot of strides in that area. And I think if you talk to veterans that are accessing the system, they'll tell you by and large it's a lot easier to navigate today than it was 5, 6 years ago.